Hi, my name is Becky Davidson, and today we will be talking about the use of biofeedback as a modality. The article that I chose to review was published in 2011 in China. It is titled Comparing Biofeedback with Active Exercise and Passive Treatment for the Management of Work-Related Neck and Shoulder Pain, a randomized controlled trial. The researchers chose to create this study because they saw a gap in research directly comparing the effects of biofeedback with the effects of traditional physical therapy approaches, such as active exercise and passive treatment modalities. They found that there were a few randomized controlled trials that compared the effects of exercise with those manual therapy, strength training, and education interventions, with varying degrees of effectiveness reported for exercise therapy and electric modalities. However, in most studies, the outcome measure was pain, and there was no evaluation of the effects of different interventions on motor control mechanisms during functional tasks. So this is what the researchers set out to further investigate. This study was designed as a randomized control trial with 60 participants that had equal opportunity for randomization among the 3 intervention groups and 1 control group, although the study was a randomized control trial since it only had 60 participants, the evidence is classified as level 2. The purpose of this study was to compare the biofeedback intervention with active exercise and passive modalities to determine the effectiveness in decreasing pain, the level of disability, and the muscle activity in neck and shoulder postural stabilizing muscles of office workers. The researchers' inclusion criteria consisted of the subjects having daily computer use, past and present history of computer-related neck and shoulder discomfort, if they had worked on a computer for 5+ years, and in the last 5 years they had no more than 3 months out of work, and in the last year they had neck and or shoulder pain for at least 30 days, worked 20+ hours per week, and no more than 2 additional regions on their body that they had complaints of in the past 30 days. And in the last 7 days, they had experienced neck and or shoulder pain. And then the researchers set the exclusion criteria as if subjects had pain in greater than 3 body regions, they had severe arthritis or joint disorders, experienced neck and or shoulder pain for less than 8 days during the previous year, and they had, if they used muscle relaxants, or if they had tumors or any inflammatory diseases, and if they had any other complaints in the upper extremity not related to computer work, they were excluded from the study. All of the participants were broken up into 4 groups: the biofeedback group, active exercise group, the passive modalities group, and then the control. And all participants in each group were given a standard instruction booklet about the principles of office ergonomics. Those in the 3 intervention groups that were also supplied with training diaries in order to monitor their compliance with the assigned intervention. All participants were required to record their daily neck and shoulder pain scores using a numeric scale of 0 to 10. So for the intervention for the biofeedback group, these participants were instructed in how to apply the biofeedback electrodes reproducibly and how to use the biofeedback machine properly while performing their regular computer work. And then they were instructed to apply the biofeedback machine for 2 hours per day, 2 days a week as a minimum. For the active exercise group, these participants were given active exercises to carry out a standardized exercise program daily on their own. These exercises included both stretching exercises and strengthening exercises using a TheraBand and focusing on the neck and shoulder muscles. And they were instructed to perform these exercises no longer than 20 minutes, 4 times per day for the duration of the trial. The passive treatment group received interferential therapy for 20 minutes and then hot packs applied to their neck and shoulder regions for 15 minutes twice a week. And then the control group was a true control, and they received only the standard education booklet that everyone else received about office ergonomics, and no other interventions were applied. The results indicate that the biofeedback group 6-week post-intervention data revealed that there was statistically significant differences in the reduction of average muscle activity amplitude of both the cervical erector spinae and the upper trapezius muscles. Additionally, the biofeedback group showed statistically significant results in pain reduction and decreased neck disability after 6 weeks of intervention and in the follow-up results at 6 months post-intervention. So good results overall. The active exercise and passive modality groups also displayed statistically significant post-intervention decreases in EMG amplitudes, pain, and reported neck disability, although the decreases were not as significant as the biofeedback group. So still effective, but just not as effective. And the control results did not indicate any statistically significant results. On the whole, the results indicate more favorable long-term outcomes for the biofeedback training compared with conventional interventions such as active exercise and passive treatment modalities. Finally, we'll be talking about the strengths, limitations, and generalizability of this study. The strengths of this study are in the design as a randomized control trial, which allows all participants equal likelihood of being placed in any one of the 4 groups. The researchers also selected strong outcome measures. The Visual Analog Scale, Neck Disability Index, and EMG are all reliable and valid measures. And lastly, the high compliance rate among subjects in all 4 groups was a great strength of the study. The limitations of the study include a small sample size represented, which makes it difficult to generalize the results to a broader population. A power analysis based on EMG research indicated that a larger sample size was needed, although a power analysis based on the Visual Analog Scale and Neck Disability Index revealed adequate sample size. So there's a bit of a discrepancy in the sample size, and that would be something to further research in future studies. Also, in the 6-month follow-up assessment, there was a small sample size and only pain and neck disability were assessed. It would have been beneficial to also measure EMG of subjects while they were typing to compare pre-intervention data to 6 months post-intervention data in order to better assess the long-term effects of this biofeedback treatment. The results are also limited to the use of the portable biofeedback machine the researchers chose, which is called the Prometheus system, and it was used within this study. So we're really unable to generalize the results to all biofeedback machine methods, but in conclusion, we can say that this research indicates that biofeedback is an effective modality in comparison to active exercise and passive modalities to decrease pain, level of disability, and muscle activity in the neck and shoulder postural stabilizing muscles of office workers. Thank you.